This podcast is produced by Outcomes Rocket, your healthcare exclusive digital marketing agency. Outcomes Rocket exists to help healthcare organizations like yours to maximize their impact and accelerate growth. Visit outcomesrocket.com or text us at 312-224-9945.
Welcome to Imaging and Teletech Innovations, brought to you by Teleray. I'm your host, Tim Kelly. Join us as we explore the latest trends and developments in teleradiology and imaging solutions. From expert insights to real-world case studies, we cover everything you need to know to stay ahead in the rapidly evolving field of radiology. So sit back, relax, and let's dive in. Welcome, Ashley Flood, the imaging system analyst specializing in project management, digital adoption, and quality improvement. Welcome to the podcast, Ashley.
Yeah, thanks for having me.
Sure. Can you tell us a little bit about yourself?
Sure. So I've been in healthcare, specifically imaging, for 13 years and counting. I am registered in X-ray and CT, and I have a master's degree in health informatics. Started my journey in CT scan and served there for about 10 years before moving into the imaging systems analyst role. And I am currently serving as the lead imaging systems analyst at Hamilton Healthcare System.
Wait, where's Hamilton located?
So Hamilton's in Northwest Georgia. We are a not-for-profit 255-bed hospital that partners with a group of physician specialty practices.
And how did you come across Hamilton and end up working there?
I actually started there as a student tech, and I've just been there ever since, just kind of moving up in different roles.
Okay, so you've been there a long time, knowing inside and out.
Definitely.
So what are your organization's general challenges and what you're facing to try to solve, using new technologies, patient satisfaction, and those types of things?
Yeah, definitely. So we just installed a new CT scanner, and kind of my role in that was to help with the install and help work with the IT team on connectivity and the PAC setup. And with that, just kind of thinking about PACs and image size. We all know that the use of imaging is on the rise, and that only continues to grow. So my organization performs about 500 various imaging studies per day, and we send 40,000 to 50,000 images to PACs each day. So image size can vary, and just to kind of help put this into perspective, a typical CR study can have an average of about 3 images, which is roughly 10 megabytes. A PET scan can have approximately 1,200 images and be around 170 megabytes. But then you have your larger studies like Tomo exams, which have an average of about 20 images and can be around 700 plus megabytes. That's obviously a lot of data to store. But I think the biggest worry for me is just kind of keeping the data safe. Thankfully, we do have lots of preventative measures in place. One of these measures is that we have our data replicated and stored at 2 offsite secure locations.
So when looking at the growth of radiology and these new imaging systems like your new CT, when you have to move data around outside of the hospital, what kind of technology challenges do you see with that? You were talking about the image size too, which always creates some challenges. But how do you guys facilitate that?
Definitely. So we can obviously send and receive images via our PAC system, but we do also have nuanced power share in place. And this allows us to connect with different organizations so that we can send and receive images electronically and securely with any organization that we are connected with. And that kind of helps also in terms of getting rid of the CD burning. It just allows for a more efficient process for our patients and our organization.
Or CD burnings, it's got to go away.
It does, definitely.
The last vestige of this, thing they're good for is coasters, so.
Exactly.
So with the lack of doctors, radiologists, and specialists actually becoming fragmented and there's not enough of them anymore, do you see or do you guys use telehealth technologies to solve some of those problems too?
Yeah, we do. Actually, last fall, we rolled out our telehealth services, and I think that's just great for our community. It just provides another level of convenience for our patients.
Since you're kind of like in a remote area, do you deal a lot then with rural health and outreach programs to get access to these basically underserved communities.
Definitely. And I think, at least from an imaging perspective, one outreach program that we have in place is Nuance's follow-up manager. An example of this would be if we had a patient that were to come to the ER for a trauma and get a chest CT scan. And during that scan, it also showed an incidental finding of a lung nodule that did need follow-up. Follow-up manager actually crawls the report text looking for any exam that requires additional follow-up. It then generates a letter that we mail to the patient stating that they should go and see their PCP for follow-up. And I just think that this allows us to ensure that we're closing the loop for our patients.
Right. So being that, hospitals are typically competitive, do you guys find yourself in competitive situations, or, you're more remote and not in a big city?
Kind of. We do. We are standing up a lot of physician practices and convenient cares. And that just allows our patients in the surrounding area to have a more convenient location to be seen at.
And then with going back to telehealth here, that the growing demand by patients, are you seeing more with that? And then looking at things like interventional radiology, where a lot of people avoided scans, especially during the pandemic, because they didn't want to be healthcare environment where I think they could get sick. But it kind of was the impetus of people saying, okay, I can just do this like we're having this conversation now.
Yeah, I think that's definitely advantage of telehealth. You don't have to go and sit in a waiting room with other patients. You can simply just go to our website and schedule an appointment and almost speak instantly with a provider. So I think that's great.
Yeah, it's definitely, people don't have to take a day off of work anymore. They can
Exactly.
that's like I am right now.
Yeah.
So looking at what you've been in Hamilton all these years and done all these different implementations, what do you think is the biggest lesson you've learned through these different processes you've been through?
Yeah, so I think for me, the biggest lesson learned is just to never assume anything, and communication is key. It doesn't matter how big or small you think something is. Communicate and collaborate and work together. Never assume, and always ask your questions if you have them.
Yeah, that's true. There's a lot of assumptions out there, and it never works in healthcare.
Yeah, get you in trouble.
Right. So looking at like all the compliance issues, the HIPAA compliance, data integrity, the fear of, hacks and all this stuff, how do you guys deal with those issues?
So my IT team does a really good job at being proactive with this. We have just your obvious standard password requirements, network monitoring, virus scanning, just whitelisting on any necessary permitted application, and even penetration testing. For me, I just try my best to be as vigilant as possible. If something looks off, I usually have my IT team take a look into things.
Right. So I know you guys aren't a current Teleray customer, but you did mention, that you have outreach programs, rural health. One of the things that we do is we have remote control of modalities. So you could have an ultrasound or a digital x-ray out in the field and have a tech control it from a distance, with a rad tech setting up a patient, and also live streaming. So you can see patient positioning and then get the images sent back for a specialist or your PACs, and might be something we can show you guys in the future that you can look at.
Yeah, definitely. We are always open to anything like that. We're just looking to grow and innovate. So that would be great.
Great. Well, we'll plan a demo so you guys can see what that's all about.
Okay, that sounds great.
So you're going to leave the guests with one last thing to think about as some of these topics that we discussed today. One last thought, or what would that be?
I would say just keep working hard and innovating. Healthcare has grown so much, and I'm really excited to see what the future holds, especially in the imaging world.
All right, Ashley. Well, thanks for your time today and good insight there, and look forward to talking to you again in the future.
Yes, thank you, Tim.
Welcome. Thanks for joining us today on Imaging and Teletech Innovations, brought to you by Teleray. We hope you like this episode. If you have any questions or feedback, please don't hesitate to reach out to us at info@teleray.com. Be sure to subscribe to the podcast so you don't miss any future episodes, and stay tuned for more insights into imaging solutions and teletech with Teleray.
This podcast is produced by Outcomes Rocket, your healthcare exclusive digital marketing agency. Outcomes Rocket exists to help healthcare organizations like yours to maximize their impact and accelerate growth. Visit outcomesrocket.com or text us at 312-224-9945.